Hi, my name is Wayne Guerra and I'm the co-founder and chief medical officer of iTriage. Cellulitis is an infection just below the skin. Typically we all have bacteria that live on our skin, both Staphylococcus and Streptococcus, or staph and strep. And there's a disruption in the skin that allows these bacteria to get down below the protective layer of the skin and cause an infection. It certainly has a higher incidence in patients who have a depressed immune system, either because they're taking chemotherapy agents, they have the HIV virus, or they have other medications or another disease that's depressing their immune system. Yeah, it certainly can. That infection, if left untreated, can spread into the bloodstream. Those bacteria then can get into other body organs and other areas. Sometimes the infection can go deeper, and a cellulitis can actually turn into something called necrotizing fasciitis. And the fascia are the deeper layers of your skin, or deeper layers of your body. Usually it's the arms or the legs, and that can be extremely serious and actually take your life. If a patient has cellulitis, they need medical treatment, and you shouldn't delay. The earlier the treatment is started, the quicker the infection will go away. Typically the symptoms you'll see are the skin gets hot, it gets red, and can even be a little swollen. And so the quicker you get treatment, the better. IV antibiotics are the treatment. It just depends on how severe the infection is, whether the provider decides to use antibiotics by mouth or intravenous antibiotics. There are even patients that can go home with an IV and receive their antibiotics at home. For patients that are sick, like we're worried that maybe it's in the bloodstream, or they have a fast heart rate or a high fever, or they have a depressed immune system, they may get hospitalized. Certain types of cellulitis caused by what's called MRSA, or methicillin-resistant Staphylococcal aureus, require special antibiotics, not the typical antibiotics. But they can also be taken either by mouth or by an intravenous line.